Hello and welcome to the 2020 ACA Open Enrollment webinar. I'm Rachel Dower and I have here with me Karen Carter. We are financial advocates with Carol's Wish, which is a program of the Colorado Ovarian Cancer Alliance. The mission of our program is to ensure that nobody goes without medical care or receives substandard medical care for financial reasons. To do so, we currently work with patients with gynecologic cancers to help minimize their out-of-pocket medical expenses. One of the best ways to do this is through insurance optimization, making sure that each patient has the best and most appropriate insurance policy given her diagnosis, treatment plan, and financial circumstances. So that's a great place to start, and the reason we are doing this webinar tonight. Sometimes we can't do enough to optimize a patient's insurance, in which case we are often able to find other ways to help minimize out-of-pocket expenses. So please do feel free to reach out to either of us anytime if you need more assistance with choosing or enrolling in a plan, or if you're feeling the financial burden of your medical treatment and need help beyond insurance. We are going to provide our contact information at the end of the presentation. So let's get started. First, we'll go through some basic information just to get some background and understanding of how health plans work. We'll debunk a few myths about health insurance, and we'll let you know where to shop for plans and what to look for. Next, in part 2 of this webinar, Karen will actually walk you through the website for the Colorado Marketplace, so you can get familiar with the website and how to shop for and compare plans. What is open enrollment? Well, open enrollment is the time of year when you can enroll in an Affordable Care Act or ACA health plan or switch between ACA plans through what's called the Marketplace. I do want to point out that your insurance policy is not written in stone. Even if you're outside the open enrollment period, there are certain circumstances that will trigger what's called a special enrollment period. That's a period of time when you'll be able to enroll in or change plans, but that's typically only going to be an option if you had a major life change, a significant change in income, having a baby, getting married, a move out of state, etc., or if you have recently lost employer-sponsored coverage, or if you were dropped from Medicaid. If you have a change in circumstances during the year, please feel free to reach out to us and we will help you determine whether you're eligible to make a change to your health plan. Another note, there are limited private plans available outside the Marketplace, but we're not going to cover those here. You'd be best off speaking with a broker to learn more if you're not able to find something that suits your needs through the Marketplace. So the open enrollment period this year started on November 1st and goes through December 15th. If you enroll in a plan anytime during this period, your coverage will begin January 1st of 2020. We're just going to jump right in and get familiar with some of the lingo to make sure we're all up to speed on the basics. First is the premium. That's the amount you pay each month for your policy. Your premium will remain the same throughout the year, although it may and probably will go up each year when your plan renews. You pay your premium each month regardless of the amount of health care you use in that month. So the least amount you're going to spend on your health care in any given year is the total of your monthly premiums. So just for easy math, if your premium is $100 a month, your total premiums in a year would be $1,200. So even if you use zero health care in that year, you would spend $1,200 that year. Your deductible is the amount you must pay for health care before your plan pays anything. So for example, if you have a $3,000 surgery and your deductible is $1,000, you're going to pay that $1,000 before your health plan kicks in at all. Your health plan would then start paying its share, which varies depending upon the policy, on the remaining $2,000 of that $3,000 surgery. A copay is a set amount you're going to pay for a covered visit or procedure. For example, you may have to pay $20 to see your doctor or $30 for a prescription, regardless of the actual price of that doctor visit or prescription. So sometimes you may be paying more than it would have actually cost and sometimes less. Coinsurance is the amount of your health care costs that you must pay after your deductible is met. This is typically expressed in a percentage. So for example, if you have a $100 procedure and you have already met your deductible and your coinsurance is 20%, you will pay $20 and your insurance will pay the other 80% or $80. Plans will vary on whether they use copays and or coinsurance. Some use just one or the other and some use both. The maximum out of pocket, or MOOP as we like to call it, is the maximum amount that you will have to spend on your health care in any given year. Once you have spent this amount out of pocket on deductibles, coinsurance, and copays, your plan will pay 100% of your covered health care costs for the rest of the year. It's important to note that the amount you paid for your premiums is not included in your max out-of-pocket amount, or your MOOP. So to figure out your true total maximum out-of-pocket for the year, you need to add together your premiums, the total premiums for a year, and your MOOP amount under your policy. For example, if your premiums are $100 a month, that's $1,200 a year. Remember, that's the least you will end up paying for health care in that year. If you use a whole lot of health care that year, the absolute most you'll be paying that year is the $1,200 for your premiums plus your maximum out-of-pocket amount under your policy. So suppose your MOOP under your policy is $1,000. When you add that to your premiums, that's a total of $2,200 you will pay for health care in that year, all in. Most people will fall somewhere between the total monthly premiums and the premiums plus the MOOP. However, for those with a cancer diagnosis, many will hit their MOOP under their policy, so it is crucial to look at that maximum exposure when considering which plan is best. What probably helps to make sense of all this is an example. I know this looks complex, but bear with me for a minute and we'll go through it together. So let's suppose for this example, Joe has a deductible of $550, a MOOP of $1,000, and his coinsurance is 20%, which means his plan pays 80%. He also has a copay of $50 for an office visit. Let's suppose Joe goes in for an office visit. The doctor charges $100, but since Joe has a $50 copay under his plan, he will only pay $50. Because remember, a copay means he pays that set amount regardless of the actual amount of the visit. His plan will pay the other $50. So for keeping track of how much of Joe's $550 deductible has been met, it's now up to $50. Since he has paid $50 out of pocket, he's also met $50 of his $1,000 MOOP. Joe now needs surgery that costs $1,000. We know that since Joe has coinsurance of 20%, that means his plan pays 80% of his care. But don't forget, he has to meet that $550 deductible first. As we discussed earlier, the deductible is the amount the patient must pay before the plan pays anything. Well, he's only met $50 of that $550 deductible. So the first $500 is going to be Joe's responsibility. After he pays that $500, he has now met his deductible of $550, which means that his plan will now pay for 80% of his medical bills. After the $500 he paid toward his deductible, there's $500 left to pay for the surgery. Joe has to pay 20% of that because his coinsurance is 20%, which is $100. So the total amount he's going to pay is going to be $100 for his coinsurance plus his $500 deductible, or $600. His plan will pay for the remainder of the $1,000 surgery, or $400. Adding Joe's portion of $600 to the $50 he's already paid towards his maximum out-of-pocket, we can see that he has now met $650 of his $1,000 MOOP. Well, it turns out Joe needs a second surgery, and this one costs $1,750. Remember that Joe has met his deductible of $550, and his coinsurance is 20%, so the plan pays for 80% of everything going forward. So Joe's coinsurance for this $1,750 surgery will be $350. That $350 is then applied toward his maximum out-of-pocket of $1,000. So when we add that $350 to the $650 he has already met, Joe has now met $1,000 of his maximum out-of-pocket. That means that beyond his monthly premium, which he has to pay regardless, Joe does not have to pay for any more covered healthcare services. His plan will pay 100% for the rest of the year. So when Joe breaks his leg in a fall later that year, the $10,000 bill is paid entirely by his health plan. All right, we have the basics of how health insurance plans work. Now let's talk a little bit about the Affordable Care Act, or Obamacare, as some of you may know it. There are two big myths that I want to make sure to debunk. Myth number one is that you cannot get insurance coverage with a pre-existing condition, or that your plan will drop you if you are diagnosed with a serious illness. And the second myth is that health insurance is just too expensive. Many patients I work with simply believe they are priced out of health insurance. Well, the Affordable Care Act addresses both of these concerns. So let's look at some key features of the Affordable Care Act. Under the Affordable Care Act, insurance companies must cover members with pre-existing conditions without charging a higher premium. So even for folks who already have a cancer diagnosis, they cannot be denied nor charged a higher premium due to their diagnosis. Second, the Affordable Care Act requires insurance companies to pay for basic preventive care, which includes things like vaccinations, pap smears, and mammograms. And the third other really important feature of the Affordable Care Act is that financial assistance is available to ensure that premiums and out-of-pocket costs are affordable for everyone. And we'll get back to the specifics of that in just a minute, but first I want to talk about the types of health plans that are available under the ACA. As you can see, there are three types of plans: bronze, silver, and gold. As you probably guessed, gold is going to give you the best coverage, but since you get what you pay for, it's also going to have the highest premiums. So the gold plans are a good choice for those who anticipate needing a lot of health care throughout the year. On the other end, the bronze plans have the lowest premiums, but the plan is going to pay less of their health care costs. These plans are typically a better choice for those who don't anticipate needing a lot of health care throughout the year. The silver plans right in the middle here can be a little tricky, but typically those tend to be the best for those who qualify for financial assistance. So with that, let's talk about the financial assistance available. There are two types available, and eligibility for both types is determined solely by income. The first is called premium tax credits, and the purpose is to reduce the cost of the monthly premiums. These are tax credits, not deductions, so they will offset your tax liability dollar for dollar. Or if you have no tax liability, you'll just get those dollars, either in the form of a reduced premium or as a tax refund. If you do qualify for premium tax credits, you have two choices. You can take them in advance by paying a lower monthly premium, or you can pay the full premium each month throughout the year and then claim the credit on your taxes when you file. One thing to note, though, that's really important is that the tax credits are available on a sliding scale based on income. So to determine your available premium tax credit amount, you're going to need to predict your income for the year. At the end of the year, if your income turned out to be higher than you thought it was going to be, then you would be entitled to less premium tax credits. And if you have taken them in advance, you will have to pay back the difference. On the other hand, if your income is lower than you thought it was going to be, you will get a refund of the amount you were actually entitled to. So these credits are available to those with an income of less than 400% of the federal poverty level. In a few slides from now, I'm going to show you a little chart so you can see what that looks like. But just to give you an idea, 400% of the federal poverty level for a household of one is just under $50,000. So these premium tax credits are not just for the very, very low income group. In fact, 77% of consumers qualify for financial assistance of some sort under the ACA. Also important to note, premium tax credits are available to any level plan, bronze, silver, or gold. I do want to mention if you are offered an employer-sponsored plan that's affordable and provides minimal essential coverage, which most employer-sponsored plans do, you are not eligible for the premium tax credit. The same is true if your income is below 138% of the federal poverty level. At that point, you're eligible for Medicaid, and you will be expected to enroll in Medicaid rather than taking the premium tax credit on an ACA plan. The other type of financial assistance is called cost-sharing reductions. Now, to qualify for cost-sharing reductions, or CSRs, you do have a lower income threshold, which is less than 250% of the federal poverty level. So back to an example of a household size of one, CSRs would be available to those making under approximately $31,000 a year. Again, they are available on a sliding scale based on income, and they are also unavailable to those who are offered employer plans or those eligible for Medicaid. Another important note is that CSRs are available only if you buy a silver plan. How do cost-sharing reductions work? Well, they do two things. One, they reduce the deductibles and the maximum out-of-pocket amounts on your plan. And two, they increase the actuarial value of the plan, which means the amount paid by the plan. So if the plan typically pays 70%, with the cost-sharing reduction, that same plan may pay 75 or 80 or even 90%. So your coinsurance is going to be lower if you do qualify for the CSRs. It can get complicated trying to calculate the specifics, but the Colorado Marketplace has made it really easy. And Karen will show you later when she walks you through the website. There is a place on the website where you can enter your income and the number in your household, and it will let you know which kind of financial assistance is available to you and in what amount. So as I promised, here's a chart showing a percent of federal poverty level for different household sizes. Like I said, you can just enter your income in a calculator and it will let you know, but this will give you an idea of whether you might qualify. Remember that the premium tax credits are available for those with incomes under 400%, which is this column right here. The cost-sharing reductions are available for those with a household income of less than 250% of the federal poverty level. So your income would need to be under this amount in this column. And 138% I put on here because that is the threshold for Medicaid in Colorado. If your income falls under this 138% based on your household size, then you will qualify for Medicaid, and that's the program you should be enrolling in. And if you do need help with that, we are available to help you to enroll in that as well. As you'll see when you start to shop, there are a ton of different policies available. So we've tried to narrow down the most important factors to consider when choosing a policy. First is my current provider in the plan's network. If you have a doctor or doctors you've been seeing for a while that you really love and you want to keep seeing, make sure those providers are in network with the plan you're looking at. And in fact, I would recommend that you not only check the plan, but that you also check with your doctor's office as well, just to make sure. Likewise, you want to make sure that any medications that you're currently taking or that you know are in your future are also going to be covered under your new plan. These plans can vary widely in what they cover in terms of medications, and so it can, especially with some of the expensive cancer drugs, it can be a difference of tens of thousands of dollars, so you definitely want to look into that. Next, you also want to look at whether the plan covers out-of-network providers. Some plans like HMOs have a very limited network, and you're expected to stay within their network. And this works perfectly fine for some people, and that may be you, but I have seen this become an issue when someone wants an outside second opinion or doesn't like the doctor in their network or wants to participate in a clinical trial. So it is just something to keep in the back of your mind and pay attention to when you're shopping for plans. Of course, we want to look at the cost of the monthly premiums because those you're going to have to pay regardless whether you use any health care at all or how much you use. We want to know how much is the deductible. We want to know what's the maximum out-of-pocket amount for the policy. If you think you're going to be using a lot of health care in the coming year and that you're going to meet your maximum out-of-pocket, as we talked about before, you could easily compare plans by just adding together the total monthly premiums for the year and the maximum out-of-pocket amount. And that's going to let you know the absolute most you're going to be spending on health care with that particular plan. Keep in mind, it doesn't mean you're going to be spending that amount, but it lets you know what your maximum exposure is going to be. Thankfully, you are able to filter plans by doctors, medications, and all sorts of different variables on the website, and you're going to see all this information on one page when you shop for plans and compare them. So this is the website. It's connectforhealthco.com. This is Colorado's official health insurance marketplace and the only place you can apply for financial assistance with your health care plan. In part 2 of this webinar, Karen is going to walk you through how to use the website to shop for, compare, and enroll in ACA plans. First, though, I wanted to give you our contact information as promised. Please feel free to reach out anytime if you have questions or you need assistance with the financial side of your medical care. You can also find us on the COCA website under Programs and Carol's Wish Financial Navigation. Thanks for joining us tonight. And with that, I will turn it over to Karen for part 2.